Welcome again to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This will be our lengthiest podcast to date because there's so many innovative and important developments these past 7 days. This week we will discuss the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to the 22nd of May 2025. As always, our information is drawn from regional health ministries, institutions, advanced data, and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. The third week of May 2025 saw a flurry of healthcare developments across the Middle East, marked by proactive government initiatives, international collaborations, and strides in innovation. Health ministers from multiple countries converged at the World Health Assembly, WHO, in Geneva, forging agreements to strengthen health systems and reaffirming commitments to global health goals. Life sciences and digital health innovations took center stage, with regional conferences and programs launching to boost biotechnology, telemedicine, and AI applications in healthcare. At the same time, public health challenges and humanitarian crises continue to test national systems, from heatwaves in the Gulf to conflict-related health emergencies in Gaza and the ongoing strain on healthcare in Lebanon and Syria. Amid these challenges, countries pressed ahead with wellness promotion and population health strategies, such as campaigns to increase physical activity and comprehensive plans to combat diseases like HIV. In the private sector, the region advanced its biotech and pharmaceutical capacity, with new partnerships to localize vaccine production and regulatory milestones aligning Middle Eastern pharma with international standards. Major investments in hospital infrastructure and digital health systems underscored a drive to modernize care delivery and improve resilience. Let's dive right in and start with healthcare policy and government initiatives. Government-led health initiatives and diplomatic engagements were prominent this week. Saudi Arabia and Yemen solidified a landmark healthcare cooperation agreement on May 13, laying the groundwork for a joint fund to support specialized hospitals, train medical staff, and rebuild Yemen's health infrastructure. Signed in Riyadh between the Saudi Development and Reconstruction Program for Yemen, SDRPY, and Yemen's Ministry of Public Health, the deal invites international partners to contribute and reflects Saudi Arabia's Vision 2030 focus on regional humanitarian development. At the World Health Assembly in Geneva, Middle East health ministers engaged in active diplomacy. Qatar's Minister of Public Health, His Excellency Dr. Mansour Al-Mahmoud, held a series of bilateral meetings with counterparts from Iraq, Syria, Sudan, Iran, and Cuba to expand cooperation in healthcare. These discussions, framed by the What's One World for Health agenda, addressed collaborative strategies and underscored the region's commitment to joint action on global health issues. Bahrain achieved a notable leadership role at the Assembly. Health Minister Dr. Jalila bint Al-Said Jawad Hassan was elected as a Vice President of the 78th WHO. In her address to the Assembly, Dr. Jalila affirmed Bahrain's support for WHO's efforts to ensure equitable healthcare access and stressed the importance of international cooperation and scientific innovation in building resilient health systems. She highlighted Bahrain's initiatives under King Hamad's guidance, including a new Arab Summit initiative to support education and healthcare in conflict zones and regional collaboration on pharmaceutical and vaccine production as part of the kingdom's commitment to humanitarian health action. On the sidelines, Bahrain's minister met with health officials from Saudi Arabia, Oman, Syria, and others to strengthen bilateral ties, reflecting the wider trend of Middle Eastern countries leveraging global forums to bolster health partnerships. Several intergovernmental health agreements were signed this week. Oman concluded 2 memoranda of understanding, MOU, to enhance health sector ties, one with Cuba and one with the Philippines. In Geneva on May 20, the Omani and Cuban health ministers agreed on exchanges of medical expertise, including training programs for healthcare personnel and joint scientific research in medicine. 2 days later, Oman's delegation signed a landmark MOU with the Philippines focusing on health technology cooperation, primary care strengthening, and workforce development. The agreement emphasizes sharing of best practices, exchange of health information, and joint research to improve health outcomes in both nations. These accords align with Oman's strategy to broaden international collaboration and tap into global expertise to advance its healthcare services. In Egypt, health policymakers pursued strategic partnerships to upgrade the country's health infrastructure and education. Egypt's Health Minister Dr. Khaled Al-Ghaf met with Kamal Grubi of Italy's GKSD investment holding on the sidelines of the WHO to discuss a comprehensive cooperation plan. The proposed partnership will see Italy's San Donato Hospital Group assist Egypt in establishing a state-of-the-art hospital and a global medical university in Cairo, aiming to elevate medical education and specialist care to international standards. It also envisions collaborative investment in healthcare infrastructure, joint nursing and medical training programs, and European medical fellowships to build Egypt's human resource capacity. Digital health and health information exchange featured on the agenda as well, with plans to implement telemedicine, electronic medical records, and other e-health solutions in Egypt through this collaboration. The initiative dovetails with Egypt's national strategy to modernize healthcare and attract foreign investment, representing a government push to improve both care delivery and medical innovation capacity. Jordan took steps to strengthen health governance and data systems. The Ministry of Health in Oman launched a national health accounts and COVID-19 spending review, announced May 15 via state media, enhancing financial transparency and planning for the health sector. Additionally, Jordan's National Center for Epidemics, JCDC, signed an MOU with the country's leading e-health platform, Hakim Electronic Health Solutions, on May 21 to modernize health information systems and promote community health awareness. JCDC Director Dr. Adel Al-Belbisi noted that better integration of medical information and research data will improve decision-making and the quality of care, especially in primary health care, which he called the cornerstone of Jordan's system. The partnership will unify efforts in public health monitoring, including developing a central health database, even incorporating One Health data on human, animal, and plant health, and build capacity through shared knowledge resources. By enhancing informatics and research, Jordan aims to keep pace with future health challenges and ensure policymakers have robust evidence for managing population health. Syria's health leadership focused on securing international support for its war-battered healthcare system. In Geneva on May 22, Syrian Health Minister Dr. Musab Al-Ali met with WHO Director General Dr. Tedros Adhanom Ghebreyesus to appeal for sustained aid. Dr. Tedros affirmed that WHO would not reduce health assistance to Syria, granting an exemption from any global funding cuts in light of Syria's exceptional circumstances. This commitment is crucial for Syria, where conflict and sanctions have severely weakened health services. Minister Al-Ali extended an invitation for Dr. Tedros to visit Syria to witness the needs firsthand and bolster the WHO-Syria partnership in guiding recovery efforts. The meeting demonstrates how Syrian authorities are actively engaging international organizations to maintain essential health programs and rebuild capacity. Neighboring Jordan and Bahrain also signaled support for Syria's recovery, as their foreign ministers publicly affirmed backing for Syria's reconstruction process and reintegration into regional initiatives, per a SANA report on a separate sidelines meeting. Such diplomatic support, alongside direct WHO assistance, represents an opportunity for Syria to begin restoring its health sector after years of crisis. So let's switch now to life sciences and research innovation. A strong current of life sciences innovation swept through the region this week. Saudi Arabia launched a major initiative to nurture domestic biotech talent, aligning with its Vision 2030 innovation agenda. The Ministry of Health introduced a new biotech accelerator program to empower Saudi innovators in biotechnology and life sciences. Announced in early May, the 7-month accelerator provides selected researchers and startup founders with mentorship, training in scientific and commercial skills, and networking with local and international investors. Participants will attend advanced workshops, one-on-one advisory sessions, and gain the exclusive opportunity to showcase their innovations at the BIO 2025 Global Biotech Conference. With interviews of candidates held during May 15 to 20 and final selections due May 25, the program was in full swing this week. Saudi officials highlighted that this effort, under the National Biotechnology Strategy and Health Sector Transformation Program, is designed to enhance the readiness of Saudi researchers and startups to attract investment and bring scientific breakthroughs to market. By boosting homegrown biotech ventures in fields from pharmaceuticals to genomics, Saudi Arabia aims to foster a knowledge-based economy and improve healthcare quality through local innovation. Israel showcased its status as a regional hub for life science research and health technology. Tel Aviv hosted Biomed Israel 2025, the country's premier annual life sciences and medtech conference, from May 20 to 22. The gathering drew thousands of participants from academia, industry, and venture capital, underscoring Israel's vibrant biotech ecosystem. According to event organizers, Biomed 2025's program spanned cutting-edge topics, unlocking a new era in brain health innovation, digital biomarkers and digital pathology, the convergence of AI with medicine, advances in women's health, and Israel's contributions to breakthrough therapies. With an estimated 10,000 attendees and over 500 exhibitors, the conference served as a showcase for the latest research partnerships, startups, and biomedical breakthroughs emerging from Israel and beyond. Notably, despite the backdrop of recent conflict, investment in Israeli health tech has remained robust, and forums like Biomed allow local innovators to connect with global markets and collaborators. The event's success signals continued confidence in Israel's life science sector as a driver of medical innovation in the Middle East. Regional collaboration in R&D was also evident. Egypt's engagement with international partners promises to bolster research and training capacity. As part of the Egypt-Italy Health Cooperation Plan noted earlier, the two sides intend to establish research and innovation centers to drive scientific advancement in the healthcare sector in Egypt. This will go together with setting up a new medical university, ensuring that research findings can be translated into improved medical education and practice. By leveraging expertise from Italy's San Donato Group and others, Egypt aims to create a hub for medical research in Cairo that can serve the wider region. Additionally, Oman's newly signed health agreements, with Cuba and the Philippines, include provisions for joint scientific research in health and medicine, a recognition that knowledge exchange can accelerate innovation. For example, Oman and Cuba will cooperate on research in medical sciences and specialized training for Omani clinicians, tapping Cuba's renowned biotech sector. These initiatives reflect a broader trend. Middle Eastern countries are investing in research collaborations and innovation platforms, from accelerators and conferences to academic partnerships, to ensure the region keeps pace with global advances in life sciences. On the global health innovation front, the World Health Organization introduced a novel tool with implications for research and emergency response. On May 15, whose Eastern Mediterranean Regional Office, EMRO, in Cairo launched an AI-powered, All Hazards Information Management, AIM, toolkit to revolutionize health emergency preparedness. This generative AI system can synthesize and draft critical response plans and risk assessments in minutes rather than weeks, dramatically speeding up the production of technical documents during disease outbreaks or humanitarian crises. Developed with support from NORCAP and whose Pandemic Intelligence Hub, the AIM toolkit was designed in response to the multiple protracted emergencies in the region, from epidemics to conflicts, that strain public health capacities. By instantly organizing WHO guidance, defining action plans, and auto-generating country-specific response documents, the AI tool frees up experts to focus on decision-making and research, rather than paperwork. The introduction of this technology in the Middle East illustrates how cutting-edge AI research is being applied to public health, potentially serving as a model for other regions. What happened this week in biotech and pharmaceutical developments? Let's review. The week brought significant developments in the Middle East's pharmaceutical and biotech industries, as countries pursued greater self-reliance and integration with global standards. In the United Arab Emirates, a high-profile industry forum showcased efforts to localize drug and medical device manufacturing. At the Make It in the Emirates Investment Forum in Abu Dhabi, held May 2025, a dedicated healthcare industry pavilion gathered local pharma companies, medical supply firms, and international partners to forge manufacturing alliances. Dr. Anwar Salam of Burjeel Holdings highlighted that multiple joint ventures were being negotiated to produce specialized pharmaceuticals and high-precision medical equipment within the UAE. Under the auspices of the Ministry of Industry and Advanced Technology, these deals come with streamlined regulations to facilitate technology transfer and factory setup. The goal is to boost the UAE's capacity to meet national medication needs and export to regional markets, strengthening its leadership in healthcare manufacturing. Industry experts noted that attracting foreign partners to produce critical items, from surgical supplies to ICU equipment, will localize expertise, create high-skilled jobs, and secure supply chains for the long term. This reflects a broader push in the Gulf to become regional pharma hubs, reducing import dependency and fostering innovation by making everything from vaccines to medical devices at home. Kuwait made a notable move on the regulatory front, aligning its pharmaceutical sector with international best practices. The Ministry of Health announced on May 19 that Kuwait has officially joined the International Council for Harmonization, ICH, of technical requirements for pharmaceuticals for human use as an observer member. This membership in the ICH, a global body that sets unified standards for drug quality, safety, and efficacy, is a significant step in upgrading Kuwait's drug regulatory system. Dr. Dina Al-Bastaki, who heads drug registration, represented Kuwait at the ICH Assembly and emphasized that participation will allow Kuwait to adopt internationally endorsed guidelines and collaborate with regulators from the US, Europe, and Japan. By integrating into ICH working groups, Kuwait can fast-track the modernization of its pharmaceutical laws and oversight mechanisms. Practically, this means Kuwaiti patients and companies will benefit from smoother approval of medicines and perhaps quicker access to new therapies that meet global standards. Coupled with recent policies like setting price controls for dozens of medicines in the private sector, a decision reported by local media on May 20, joining the ICH signals Kuwait's commitment to a transparent, high-quality pharmaceutical environment that encourages investment while protecting patients. Vaccine production capacity is another focal point. Egypt used the week's Global Health Assembly to advance its vaccine self-sufficiency goals. In Geneva, Dr. Khalid Al-Ghaf met with Gavi Alliance Chairman José Manuel Barroso on May 22 to discuss scaling up local vaccine manufacturing in Egypt and across Africa. EgyptToday.com. The Egyptian side outlined policies to expand promotion of vaccine production, building on existing facilities that manufacture routine vaccines, with Gavi providing technical and strategic support. EgyptToday.com. They also agreed on cooperation to strengthen immunization programs and primary healthcare, aiming to ensure equitable access to vaccines in Africa and the Middle East. EgyptToday.com. This reflects Cairo's ambition to become a regional vaccine hub, a role it played during COVID-19 by producing Sinovac shots locally, and dovetails with African Union initiatives for vaccine security. Gavi's involvement could facilitate technology transfer and financing for new vaccine lines in Egypt. Indeed, both parties stressed improving supply for underserved regions. Egypt's push will not only cover its 100+ million population but also contribute doses to neighboring countries, reducing reliance on imports. This meeting underscores the importance of public-private and international partnerships in Middle Eastern pharma development, leveraging global health organizations to build regional capacity that can respond to future pandemics or outbreaks. Bahrain also emphasized pharmaceutical development in a regional context. In her WHA remarks, Minister Dr. Jalila referenced an initiative launched by Bahrain's king during a recent Arab summit to support pharmaceutical and vaccine production in collaboration with the Arab League and WHO. This initiative aims at pooling Arab resources and expertise to manufacture critical medicines and vaccines, especially for conflict-affected areas, thereby improving regional health security. While details are still emerging, Bahrain's advocacy hints at a coordinated Middle Eastern approach to biotech sovereignty, ensuring that the Arab world can produce essential health commodities for itself. Similarly, Oman's hosting of the 2025 Arab Forum for the Development of Pharmaceutical and Vaccine Industries, which Bahraini officials noted was held remotely earlier this year, points to collective efforts in knowledge sharing and investment to boost the region's pharma sector. In Iran, although not highlighted in Geneva, scientific institutes are reportedly making strides in biotech innovation as well. Iranian media earlier in the year touted a homegrown, anti-cancer, vaccine due by summer 2025, developed by the National Institute of Genetic Engineering and Biotechnology to address a range of cancers and reduce dependence on imported therapies. If realized, this would be a groundbreaking development for the region's biotech scene. Such news, along with the above initiatives, illustrates how Middle Eastern countries are not only consuming medical innovations but increasingly becoming producers, from R&D to manufacturing and regulatory excellence, thereby transforming the regional pharmaceutical landscape. Public health challenges and disease outbreaks were a key area this week as well. Public health authorities grappled with both acute and chronic challenges this week, from climate-related health risks to the aftermath of conflict and the threat of infectious diseases. In the Gulf, extreme heat emerged as an urgent health concern. A severe heat wave in Kuwait prompted the Ministry of Health on May 22 to issue stark warnings and guidance for the public. Officials cautioned that the remarkable increase in temperatures was leading to a spike in heat-related illnesses, heat stress, heat stroke, dehydration, and called for intensified public awareness efforts to prevent harm. The ministry's advisory explained the symptoms of heat exhaustion, fatigue, dizziness from loss of fluids and salts, and heat stroke, dangerous rise in body temperature leading to possible loss of consciousness. It stressed that many people feeling weak or lethargic during the day were experiencing physiological effects of heat and dehydration, not mere laziness. To counter this, the public was urged to stay properly hydrated, drinking 2.5 to 3 liters of water daily even if not thirsty, and to avoid direct sun exposure during peak hours, 11 a.m. to 4 p.m., when the risk of heat stroke is highest. Special caution was advised for vulnerable groups like the elderly and those with chronic conditions, as extreme heat can trigger blood pressure drops and electrolyte imbalances. Kuwait's heatwave alert exemplifies a broader regional challenge. With climate change, many Middle Eastern countries face rising temperatures that pose public health risks, forcing health ministries to incorporate climate adaptation into their public health messaging and emergency planning. Other communicable disease threats were addressed through strategic planning. On May 15, Kuwait launched a national HIV/AIDS strategy 2025 to 2029 as part of its commitment to end the AIDS epidemic as a public health threat. The 5-year strategy, developed by a national committee with input from international experts, aims to mitigate the impact of the epidemic by 2030, while ensuring comprehensive care for people living with HIV. It adopts an integrated approach covering prevention, treatment, and support, aligned with global best practices. Key objectives include reducing new HIV infections, expanding early diagnosis, with a target to diagnose 95% of all people with HIV, and improving the quality of care and life for those infected. Importantly, Kuwait's plan emphasizes fighting stigma and discrimination. It calls for nationwide awareness campaigns to create a supportive environment so that individuals feel safe accessing testing and treatment. Concrete targets were set, such as eliminating mother-to-child HIV transmission and rolling out regular testing programs in high-risk communities. The strategy also involves upgrading health information systems to track progress via over 35 performance indicators, ensuring data-driven accountability for results. Kuwait's proactive AIDS plan reflects how Middle Eastern countries are tackling persistent communicable diseases with renewed vigor, aligning with UNAIDS global strategies and the Sustainable Development Goals. Similar efforts are underway elsewhere. For instance, Bahrain and other Gulf states have virtually eliminated mother-to-child HIV transmission in recent years and continue to invest in prevention for key populations. Meanwhile, humanitarian crises and conflict-related public health emergencies remained a grave concern. In the occupied Palestinian territories, Gaza's healthcare system is in critical condition after months of war that peaked in late 2024. This week brought a stark reminder of the toll on health infrastructure. On May 13, Israeli airstrikes struck the Gaza European Hospital in Khan Yunis, one of the main medical facilities in southern Gaza. The attack, which was widely reported and condemned, killed at least 28 people, including patients and staff, and left the hospital inoperable. Jordan's government issued a strong denunciation on May 16, calling the strike a blatant violation of international humanitarian law and the Geneva Conventions. Jordan's foreign ministry decried the systematic targeting of civilians and vital infrastructure in Gaza, accusing Israel of tactics that have devastated basic services and endangered lives. The incident drew international outrage after a British doctor in Gaza released footage of the hospital's destruction, absolute mayhem, as he described it. The loss of yet another hospital further cripples Gaza's health capacity, already strained by shortages of medicine, electricity, and clean water due to the blockade. Public health officials warn of dire consequences. Trauma care, maternal health, and infectious disease control, for example, Gaza saw surges in waterborne diseases earlier, are all severely affected when hospitals come under fire. The Gaza hospital attack underscores the region's most tragic public health challenge, the direct impact of conflict on health and the imperative for protecting healthcare in war zones. Neighboring countries and international agencies continue to call for sustained ceasefires, humanitarian corridors for aid delivery, and accountability to prevent attacks on healthcare facilities. In Lebanon, a convergence of crises is fueling the risk of disease outbreaks. Health experts are sounding the alarm that Lebanon's deteriorating infrastructure and prolonged socio-economic emergency have led to a surge in preventable diseases. Reports indicate rising incidence of cholera, hepatitis A, measles, and meningitis in Lebanon, driven by collapsing water and sanitation systems, malnutrition, and large population displacements. Over 1.2 million people in Lebanon now need urgent food aid, and access to clean water has plummeted, conditions ripe for epidemics of waterborne and vaccine-preventable illnesses. Observers link this health crisis to the aftermath of war and years of financial collapse. The strains of the 2023 Israel-Gaza conflict spilled over into Lebanon, displacing families and damaging infrastructure, while Lebanon's own economic meltdown since 2019 has eroded public services. Decades of underinvestment in the public health system, and a reliance on an overly privatized model, have left Beirut unable to contain these outbreaks. A risk analysis for 2025 by Save the Children projects a high probability of major outbreaks of cholera, hepatitis A, measles, and meningitis if urgent action is not taken. Indeed, Lebanon experienced a cholera resurgence in late 2022, after nearly 30 years without a case, and sporadic cases persisted into 2024, illustrating the vulnerabilities. Health authorities, with international partners, are attempting response measures, for example, vaccination campaigns for measles and cholera and efforts to restore water treatment. However, without broad economic stabilization and infrastructure repair, the public health outlook remains worrisome. Lebanon's situation exemplifies how conflict and economic instability can ignite cascading public health emergencies, a challenge also seen in Syria and Yemen. These countries require not only humanitarian relief but also long-term health system rebuilding to avert epidemics. Encouragingly, regional and global support is being mobilized to address such challenges. The WHO's assurance of continued health aid to Syria, noted above, will help sustain vaccination, trauma care, and chronic disease programs for Syrians who have endured conflict and displacement. In Yemen, where cholera and malnutrition have been rampant in the civil war, the new Saudi Yemeni fund aims to invest in medical facilities and epidemic control measures. The European Union this week also announced increased humanitarian funding for healthcare in Gaza, Syria, and Lebanon, focusing on medicine supplies and primary care in displaced communities. These interventions highlight opportunities amidst the challenges, with coordinated support and strong public health interventions, e.g. vaccination drives, disease surveillance, WASH programs. Middle Eastern countries can prevent small outbreaks from becoming major epidemics. The collective experience of COVID-19 has also improved regional collaboration on outbreak response. For instance, Arab health ministers now routinely share disease alerts and best practices through the Arab Health Ministers Council and the EMRO network. Next, we will talk about an important topic: wellness and health promotion. Promoting healthy lifestyles and preventive care continues to be a priority across the Middle East, with multiple initiatives during the week aiming to improve community wellness and address non-communicable disease risks. Abu Dhabi took the global stage in health promotion by hosting the 25th World Conference on Health Promotion, IUHPE 2025, from May 13 to 16. This landmark event, co-organized by the Abu Dhabi Public Health Center and the International Union for Health Promotion and Education, drew over 2,000 public health experts and advocates from more than 100 countries, the first time the prestigious IUHPE Forum has come to the Middle East. Under the theme, Settings for Planetary Health and Well-Being, the conference spotlighted how the environments where people live, work, and learn can be transformed to support healthier lives. Key topics range from climate change's impact on health and building climate-resilient communities, to mental health promotion, digital health futures, and creating health-supportive schools, workplaces, and cities. This reflects an expansive view of wellness that Abu Dhabi is championing, recognizing that public health is interlinked with environmental sustainability and social equity. In his opening address, Dr. Rashid Al-Sawaidi, ADPHC's Director General, articulated a bold vision of shifting from treatment to prevention, from reactive systems to predictive models, and from siloed care to holistic, community-driven well-being. He highlighted innovative local initiatives such as a population health framework for Abu Dhabi and new climate-adaptive health strategies as examples of putting this vision into action. The IUHPE conference not only shared global best practices in wellness promotion but also positioned the UAE as a leading advocate for integrating health in all policies, including urban planning and climate action. The influence of such thought leadership is likely to ripple across the region, encouraging other Middle Eastern cities to adopt health in all settings approaches in pursuit of healthier, more resilient communities. On the national level, Gulf countries continue to advance health promotion campaigns targeting lifestyle-related risks. In Saudi Arabia, the Walk 30 initiative, a nationwide program to encourage daily physical activity, reported significant success as it wrapped up its fifth season this spring. The health minister, Fayed Al-Jalajel, led a public walk in Riyadh in late April to kick off the latest edition of Walk 30, lauding it as a pillar of the health and quality of life transformations underway in the kingdom. The campaign's simple message, walk at least 30 minutes a day, 150 minutes a week, has resonated broadly. As of this year, 58.5% of Saudi adults now achieve at least 150 minutes of physical activity per week, exceeding the 2024 target, and up from only 30 to 40% a decade ago. Even among youth, nearly 19% are meeting recommended activity levels, an encouraging improvement. Officials credit programs like Walk 30 and the complementary Healthy Cities and Healthy Mall initiatives, which open shopping malls early for indoor walkers and provide water stations and healthy dining options, for these gains. The payoff is visible in Saudi Arabia's health indicators. Average life expectancy has risen to 78.8 years, inching closer to the Vision 2030 goal of 80 years, partly attributed to lifestyle changes that reduce chronic disease. The Walk 30 campaign also has a social dimension. It has been shared as a best practice model abroad, even whose Director General joined a Walk 30 event last year, suggesting that such community-based wellness programs can be exported to other countries facing sedentary lifestyle challenges. Saudi Arabia's experience highlights a key lesson in health promotion: sustained, culturally tailored campaigns with high-level political support can shift population behaviors in a relatively short time, yielding long-term health benefits. Other examples of wellness promotion this week include workplace health and safety initiatives. In Jordan, the Ministry of Labor and international partners marked the World Day for Safety and Health at Work, late April, by engaging youth in occupational health workshops, recognizing that healthy work environments are part of overall well-being. Meanwhile, Saudi Arabia's Monshaat SME Authority concluded its Shared Healthy Workplaces program in mid-May, which delivered 15 workshops across 9 regions to encourage small businesses to implement wellness practices for employees, such as ergonomics, stress management, and active breaks. By integrating wellness into the workplace, these programs aim to boost productivity and prevent lifestyle-related conditions among the workforce. Overall, the wellness initiatives this week illustrate a dynamic push in the Middle East towards preventive health and health education. From large-scale global conferences to local walking clubs and workplace wellness seminars, the region is increasingly addressing the root causes of ill health, sedentary behavior, poor diet, unsafe environments, with proactive campaigns. The challenge that remains is ensuring these programs reach all segments of society, including rural areas and marginalized communities, and are sustained year-round. With continued political will and community engagement, Middle Eastern nations are laying the groundwork for a healthier future built on informed, health-conscious populations. Digital health innovation, a constantly developing area in the Middle East we will spend some time on now discussing. Advances in digital health were in sharp focus, as Middle Eastern countries embraced new technologies to enhance care delivery and health system management. Saudi Arabia hosted a milestone event in telemedicine and virtual care, underlining the kingdom's regional leadership in digital health innovation. Riyadh was the venue for the 6th Middle East and North Africa Telemedicine and Virtual Care Expo 2025, which opened on May 13 under the Ministry of Health's patronage. The expo convened more than 100 international speakers, 50 exhibitors, and delegates from over 50 countries, reflecting the growing global interest in the MENA digital health market. Saudi Arabia's Seha Virtual Hospital, a flagship national telehealth center, played a prominent role, showcasing how the kingdom is leveraging technology to reach patients in remote areas. This year's conference agenda highlighted advanced digital solutions for chronic disease management, mental health, and nursing, as well as cross-border telehealth regulation and data protection. Notably, sessions on artificial intelligence in diagnostics and treatment and the integration of virtual care into public health responses drew significant attention. Saudi speakers emphasized that such innovations align with the country's strategic vision for a comprehensive digital transformation of healthcare. The event also celebrated pioneering digital health initiatives, with awards for projects that have made a clear impact on patient care through technology. The takeaway from Riyadh's Telemedicine Expo is that telehealth, accelerated by the pandemic, is now firmly embedded in Middle Eastern health strategies, and countries are collaborating and sharing best practices to harness it for long-term health system improvement. Strengthening health information systems was another recurrent theme. In addition to Jordan's health IT Mao described earlier, other states are scaling up their e-health infrastructure. Iraq has been investing in electronic health records and surveillance systems as part of its post-conflict health recovery. The Ministry of Health in Baghdad, with WHO support, reports progress in establishing a nationwide digital health database and electronic patient record system in public hospitals, efforts that continued through 2024 into this year. Similarly, Oman awarded a major contract to a European tech firm, announced in May, to develop a unified national electronic medical record platform, aiming to link all government hospitals and clinics by 2026, a critical component of Oman's Health Vision 2050. These developments, while not headline-grabbing, lay the digital groundwork to enable telemedicine, big data analytics for health, and seamless patient referrals across facilities. Cross-border digital cooperation also advanced. Oman's new moves with Cuba and the Philippines include telemedicine and health IT exchanges. For example, Oman can learn from Cuba's telehealth in primary care, and the Philippines, which has many IT specialists, will collaborate with Oman on health information management and possibly health apps. Meanwhile, Egypt's planned partnership with Italy's GKSD is set to bring in international expertise to upgrade Egypt's health information systems and implement electronic records in the envisioned new hospital and medical university. On the innovation front, AI and data analytics are increasingly being piloted in health services. The WHO EMRO's launch of the AIM Toolkit, noted above in life sciences, is essentially a digital health innovation employing AI to support emergency health operations. Its promise of cutting report writing times from weeks to minutes could significantly speed up the health response in digital emergency operations centers during outbreaks. Middle Eastern ministries are keen on such tools. Already, countries like UAE and Qatar have experimented with AI chatbots for COVID-19 helplines, and Saudi Arabia's COVID-19 command center used data dashboards that are precursors to more AI-driven decision support. The region is thus an eager adopter of e-health innovations, from AI triage bots to remote patient monitoring devices. For instance, at the Riyadh Telemedicine Expo, several startups demonstrated AI-assisted diagnostic platforms and remote vital signs monitoring tools tailored for Arabic-speaking populations. Another notable digital health trend is the expansion of telepharmacy and digital prescription services. In the UAE, the Dubai Health Authority announced in mid-May a new policy framework for telepharmacy, enabling licensed pharmacists to conduct virtual consultations and home-deliver medications. This follows on the success of telemedicine and addresses convenience and adherence issues for patients with chronic conditions. Saudi Arabia and Qatar have similar e-prescription systems now widely used post-pandemic. Cybersecurity and data privacy also featured in discussions, especially given the push for integrated health databases. Delegates at the Riyadh Expo and other forums emphasized the need for robust regulatory frameworks to protect patient data as digital health expands. Bahrain, for instance, has updated its data protection law to include health data, and the UAE's new Data Privacy Law, 2022, has special provisions for health information, which were being operationalized in 2025. In summary, the Middle East is witnessing a rapid digital transformation in healthcare, with this week's events underscoring both high-level commitment and on-the-ground projects. Telehealth is moving from pilot to mainstream, national health information systems are being built out, and advanced technologies like AI are being experimented with to tackle regional health challenges, from improving emergency response to managing chronic disease. The remaining hurdles include ensuring equitable digital access, rural versus urban, and among different socio-economic groups, and training the healthcare workforce to efficiently use these new tools. However, the momentum is clearly towards a future where digital and traditional healthcare are fully integrated, a trend that could greatly enhance efficiency, expand access, especially in vast countries like Saudi Arabia or conflict zones where in-person care is hard, and personalize medicine through better data. Hospitals were also key in this week's update. The landscape of hospital infrastructure and services saw both positive developments and stark challenges in different parts of the Middle East. Several countries made strides in expanding and modernizing hospital capacity, recognizing the importance of robust health facilities for both routine care and resilience in crises. In Egypt, plans for a major new hospital are taking shape through international partnership. During discussions at the WHA, Egypt's health ministry and Italy's GKSD investment holding outlined a vision for building a state-of-the-art, international standard hospital in Egypt. This hospital, once realized, would become a center of excellence for tertiary care in the country, featuring advanced medical technologies and specialties that draw on the expertise of Italy's San Donato hospital network. The initiative is tied to broader goals of improving Egypt's tertiary care capacity and making the country a destination for medical training and research in North Africa. Alongside the hospital, the plan for a new, global medical university in Cairo will ensure a pipeline of well-trained doctors, nurses, and allied health professionals to staff such facilities. By collaborating on design, training, and possibly even joint management of the hospital, Egypt aims to leapfrog some of its healthcare infrastructure gaps and provide its large population with access to cutting-edge treatment domestically. This week's high-level meeting in Geneva indicates that political will and investment interest are aligning to turn this concept into reality in the coming years. The Gulf states continue to invest in specialty hospitals as part of their healthcare diversification. While there were no major hospital openings reported during this specific week, ongoing projects were highlighted in the media. The UAE's Ras Al Khaimah, for instance, is set to get a new 209-bed multi-specialty hospital by 2027, announced earlier this year, as part of the Arabian Healthcare Group's expansion. This hospital will cater to the growing and aging population in the Northern Emirates, focusing on areas like orthopedics, cardiology, and oncology, thereby reducing referrals to Abu Dhabi or Dubai. Similarly, Kuwait's new Jabba Al Ahmad Hospital, one of the largest in the region, which opened fully to the public last year, was in the news as it ramps up specialized services, e.g., a new cardiac center. And in April, Kuwait inaugurated a state-of-the-art maternity and pediatric hospital, a new milestone in its healthcare system, equipped with the latest neonatal ICUs and surgical suites for high-risk pregnancies, an achievement noted as part of Kuwait's 2035 vision. These investments underline a common trend in the GCC, building centers of excellence for different fields, cardiac, cancer, mother and child, rehabilitation, to provide world-class care at home and become a regional referral hub. Elsewhere, hospital management improvements were part of news. In Saudi Arabia, the Ministry of Health has been gradually decentralizing administration of hospitals under clusters to improve efficiency and patient experience. In May, it announced that patient satisfaction scores have improved in pilot regions due to quicker admissions and better referral pathways under the cluster model. And in Qatar, Hamad Medical Corporation, the main public hospital operator, revealed new digital systems for bed management and patient flow that reduced emergency department wait times. These updates tie into the digital innovation narrative but have a direct impact on hospital performance and patient care quality. An interesting development in public-private partnership, PPP, for hospitals also came from Egypt. Besides the GKSD collaboration, Egypt's government is finalizing a deal with a global healthcare operator to manage and upgrade some state hospitals on a contract basis, which was reported in local press as a means to bring international standards to public facilities without fully privatizing them. If successful, this could be a model for other countries with overstretched public hospitals to engage experienced hospital groups in improving service delivery. In summary, the hospital sector in the Middle East is a landscape of contrast and change. Some countries are in a phase of ambitious growth and modernization of hospital infrastructure, GCC states, Egypt, Iraq to an extent, while others are struggling to keep hospitals running amid crises, Lebanon with electricity shortages in hospitals, Gaza with war damage, Syria with limited supplies. This week captured both ends of that spectrum. The trend, however, is toward recognizing hospitals as vital assets that need investment, whether through building new ones, rebuilding destroyed ones, or innovating how they are run. The major opportunities lie in continuing the expansion in stable countries, and channeling more humanitarian and reconstruction aid to restore hospital services in the war-torn areas. The challenge common to all is ensuring that shiny new buildings translate into quality patient care, which means investing in health workers, maintenance, and systems of care, not just bricks and mortar. The week's developments give reasons for optimism, new hospitals coming, old ones repaired, but also sober reminders of the fragility of health infrastructure in the face of conflict. And finally, let us talk about development in population health management. Across the Middle East, governments and health organizations are increasingly turning their attention to population health management, an approach that looks beyond individual patient care to improving health outcomes for communities and nations. This past week reflected that shift, with several initiatives aimed at preventative care, monitoring health trends, and managing chronic conditions at the population level. A significant highlight was the emphasis on health for all strategies at the IUHPE conference in Abu Dhabi, as mentioned earlier. Abu Dhabi's health leaders introduced the concept of a population health framework being implemented locally, which systematically uses data to identify health priorities, such as obesity, diabetes, or smoking rates in certain areas, and then coordinates multi-sector interventions to address them. For example, if data show rising diabetes prevalence in a particular city region, the framework might integrate efforts by clinics, for screening and treatment, municipalities, for creating exercise spaces, schools, for nutrition education, and community groups, for peer support programs. This kind of coordinated population health approach was showcased as a model for managing chronic diseases and promoting well-being proactively, rather than waiting for patients to present at hospitals. The conference's focus on settings, schools, workplaces, cities, for health promotion ties directly into population health management by improving those settings, the overall health metrics of the population, rates of disease, life expectancy, quality of life, improve. Such approaches resonate in the GCC countries, where vision strategies, Saudi Vision 2030, UAE Vision 2071, etc., explicitly list population health indicators to boost, like increasing the average healthy lifespan, reducing obesity and tobacco use, etc. This week's discussions reinforced that achieving those requires cross-cutting policies and data-driven planning. Concrete examples of population health initiatives in the region include expanded screening programs and chronic disease registries. In Iraq, as part of rebuilding its health system, the Ministry of Health has adopted a family health model in dozens of primary care centers, meaning each family has a designated provider who keeps track of their health needs. This model improves continuity of care and helps manage population health by catching up on issues early, for example, tracking children's vaccinations or an adult's hypertension control. Iraq also launched national screening campaigns for common diseases. The joint WHO ministry statement noted that Iraq conducted 2 rounds of nationwide student health screenings in 2023 and 2024 to assess nutrition, vision, and school environment safety, and a national measles-rubella immunization campaign to curb outbreaks. By May 2025, these efforts were showing results, measles cases had fallen, and data from school screenings are informing new child health initiatives. Similarly, Iraq increasing its number of neonatal screening centers to over 1,000 is a prime population health measure, ensuring almost every newborn in Iraq is tested for conditions like congenital hyperthyroidism or PKU so that treatment can begin early and prevent disability. Gulf states are leveraging technology for population health monitoring. For instance, Qatar has a centralized electronic health record (EHR) system, CERNA, across Hamad Medical Corp and Primary Healthcare Corp, which allows aggregation of anonymous health data to identify trends like hotspots of asthma exacerbations or tracking control of diabetes nationally. During this week, Qatar's Public Health Department published its annual report showing improved management of diabetes at a population level. Over 75% of known diabetic patients achieved blood sugar control targets in 2024, up from 60% 5 years prior, thanks to integrated care pathways and patient education. Dubai and Abu Dhabi are implementing similar dashboards. Abu Dhabi's Malafi EHR and Dubai's Saloma system that feed into public health analytics. For example, Abu Dhabi can now estimate in near real time the percentage of its population up to date with cancer screenings or flu vaccinations, enabling targeted outreach to areas or groups falling behind. Saudi Arabia's success in increasing physical activity and life expectancy, as noted with the Walk 30 data, is another case of population health management paying off. By focusing on risk factors at the population scale, physical inactivity, which contributes to cardiovascular disease and diabetes, Saudi authorities have managed to shift behaviors enough to see an impact on life expectancy and presumably on NCD incidence over time. Saudi Arabia also has a health transformation program initiative to have 1 in 3 hospitals accredited as healthy hospitals by 2030, meaning they implement policies on healthy food, smoking cessation support, and community health education, turning hospitals into hubs for population health, not just treatment. In Iran, population health efforts continue through a robust primary health network, health houses, in rural areas, which historically helped Iran achieve high immunization and maternal child health coverage. While specific news from Iran in this week was scarce, it's known that Iran is deploying a nationwide hypertension control program. Since May is Iran's National Hypertension Month, aiming to register all hypertensive patients in a database and ensure they get regular follow-ups and lifestyle counseling, a classic population health registry approach. Egypt has embarked on a large universal health insurance rollout and, coupled with that, conducted mass screenings under its 100 Million Healthy Lives campaign, for hepatitis C, diabetes, etc. The meeting with Gavi about vaccine manufacturing also touched on expanding vaccination and primary care in Africa. EgyptToday.com, reflecting population health thinking beyond its borders, helping neighboring countries leads to better health security for Egypt's own population as well. Lastly, conflict-affected areas like Syria, Yemen, and Lebanon, while facing acute issues, also see the value of population health management once stability improves. Syria, for example, with whose help, has re-established disease early warning systems to catch outbreaks among its population. Nearly 4 million Syrians were vaccinated against polio in early 2023 under a national campaign, which continued into 2025 to keep polio at bay in a population with patchy routine immunization. Yemen, through support from Saudi and UAE, has launched local community health volunteer networks to manage cholera and malnutrition in remote villages, a population health intervention empowering local women to track health indicators in their communities and refer cases. In conclusion, the narrative in Middle Eastern healthcare is gradually shifting from reactive, hospital-centric care to proactive population health management. This week's trends, whether a regional conference advocating holistic well-being, or a country reporting improvements in screening and life expectancy, all point to the recognition that monitoring health outcomes at a population level and intervening early can save lives and resources. Challenges remain in data collection. Some countries lack reliable health statistics, and in reaching dispersed populations, refugees, nomadic groups. However, the opportunities are significant. By using modern data systems, engaging communities in their own health, and focusing on prevention, Middle Eastern nations can accelerate improvements in public health. The stakeholders from ministers to health workers are increasingly on board with this preventative, population approach. Let's conclude with this week's summary. During the week of May 15 to 22, 2025, we have showcased a Middle East that is dynamic and determined in its health sector reforms. The convergence of high-level policy efforts, like new laws, strategies, and alliances, and on-ground innovation, new clinics, tech tools, and community programs, is a positive sign. It demonstrates that stakeholders, governments, international agencies, private sector, and civil society are aligning more closely towards common health objectives. If this momentum continues, we can expect to see a Middle East where outbreaks are met with well-coordinated responses, where more cutting-edge treatments are developed and offered locally, and where citizens enjoy longer, healthier lives thanks to effective prevention and care. Achieving that vision will require navigating ongoing conflicts, ensuring equitable resource distribution, and maintaining focus on long-term goals amid short-term pressures. Yet, as evidenced this week, the region's health professionals and leaders are rising to the occasion, turning challenges into catalysts for change. The opportunities, healthier populations, resilient health systems, and collaborative regional growth are within reach, and the actions taken now are laying the foundation for a brighter, healthier Middle East in the years to come. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.